Okay. Well, for those that don't know me, I'm Kyle Stanley. I'm a dentist in California. Um, I've had a fairly interesting experience with dentistry, and maybe that's a good place to start for today because I don't think I did this last time, which was really tell my story and why I'm so passionate about this topic. So I'll start there. I had a fairly interesting experience with dentistry. It was February 2018. I came home and it was literally a dark and stormy night. I remember this because in California, we don't have very many dark and stormy nights. And I remember smelling the asphalt. It was dark outside. It was February, of course. And I came home and went to open the door, but the deadbolt was on. So I knocked on the door. My wife opened it. She was holding my 1 year old at the time. And she said, "Welcome home." And I said, "I can't do this anymore." And this is not something you want to say to your spouse without giving some context. She's like, "What do you mean? Family, marriage, kids, what are you talking about?" And I was like, "Oh, no, 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 dentistry. I can't do dentistry anymore." You see, on the outside, I had everything that my 18-year-old self wanted or myself in dental school wanted. I was a successful dentist. I had a celebrity practice in Beverly Hills doing high-end surgery and biomimetic treatment. I had these amazing mentors. I was speaking all over the world, publishing in the top dental journals. But I had a lot of challenges in my life at the time. I had patient complications. I had like a revolving door of team members. I had patients that wanted things that weren't really possible. I was going through litigation with a patient, being threatened by litigation with a team member. I wanted to have more time with my family. I wanted better physical health. I wanted to be less reactive with everybody. And I didn't want to think about dentistry at home. I loved dentistry and I loved dentistry back then too, but I still just wanted to be not a dentist sometimes. And so I finally had to say, enough is enough. And I had to make my mental, physical, and relational health a priority. I had been putting it off for way too long, and I knew something needed to change, but I didn't know what. So I went on this journey. I think for those of you that travel a lot like me, you know that when you're getting on a plane, they say when the plane is going down, put your own oxygen mask on first. And it sounds so counterintuitive. From us, we're givers. We want to help our kids, our spouses, our team, our families. And sometimes I think we forget about ourselves. And so, me being a research nerd, I went on this journey. And I went on this journey of diving deep into the research. And I know a lot of these topics of like mental resilience or mental wellness, they can feel kind of fluffy and woo-woo. But there is a ton of scientific, peer-reviewed, multi-center research out there. And so I started studying positive psychology, the psychology of overachievers like us, personal success habits, evolutionary biology. I sat under some of the biggest teachers in the world on this, and I went on this journey. And I remember I started finding my purpose outside of dentistry. I started increasing my health, my honesty and confidence with talking to patients about complications. I started dismissing patients from my practice. And I remember one day I took a day off. I took Friday off and I went to the post office and you ever go out in the middle of the day and you see all these people in the middle of the day and you're like, what? Don't you work? Like, what's wrong with you people, right? Like, we get to our practice 6:37, 7:30. We leave at 6:37. I mean, we don't even see the light of day sometimes. And I went next door. I was eating a little acai bowl. I did my residency in Brazil, so I like Brazilian culture. I was eating my acai bowl. The warm California sun was shining down on my face, and I remember thinking, I'm finally getting better. And I had this big revelation, and that is this. That is that mastering your mental and relational health is the most effective way to ensure sustainable success in your dental career. I know this goes against what a lot of us are taught, which is just get better at clinical dentistry. That is the answer. Just do better clinical work. And my clinical work was pretty good, and I was still suffering. And this was my revelation, was you have to put effort and time and money into your mental and relational health. And then when I did that, I started speaking about it. And then people started asking me to help them with it. And so I started helping doctors from around the world. I mean, people from Romania and China and Canada and Texas and New Jersey and Virginia. And my career took off. I ended up starting a dental AI company that's worth a few $100 million. I mean, my whole career just took off. And I had this, I boiled everything down to this. And this is what I'd like to talk about today, too, is something I call the thriving dentist framework. And that is this. That is that we get out of school, and whether you go to residency or not, all of you on here went to residency. You get out and you say, I gotta learn, I gotta get better. And so for you guys, it may be, I gotta get better at, doing pulpotomies, or I got to get better at sedation on these little kids, or I got to get better at stainless steel crowns, or whatever it is. And so we do that and we get better, but then there comes this decision point, and that decision point is where you start to see the symptoms. It's right before that, and that is where you start to feel overwhelmed. You start to have patient challenges. Patients want their money back. The parents are calling you. They're writing bad reviews. Your physical health may be in a poor place. You've put so much effort and time into your career that you kind of forget about your physical health. You have team challenges, anxiety, depression, burnout, and you can go in three different ways at that point. So you can become a coping dentist, and I know a lot of these. They say, yeah, this stuff's really hard, but I'm just going to keep doing the same thing for the next 20 years. Or you can be like me, which was a despairing dentist. Had anxiety, depression, burnout, and I think maybe my next step probably would have been suicidal ideation. I don't know if you guys heard because it's not really in the pedo department, but we did lose a pretty famous dentist this week who's a very well-respected oral surgeon named Frank Zastro. Or you could be a thriving dentist. And when I talk to these thriving dentists, and I would consider myself one now, the only difference is that they make the second half of their career focusing on their mental and relational health. That's it. And so this was how I came up with this idea of the dark side of dentistry and the light side of dentistry. I was in the dark side of dentistry. I didn't know it at the time. And I didn't know that there was a light side of dentistry. And so that's really where I'm coming from today is I've been at the bottom, I'm now at the top, and I've helped thousands of dentists get there. And I think for the dentists on the call, you guys know no one understands a dentist like another dentist. Because I know if you've been through hard times and you've talked to a friend that is not a dentist, they go, Jeff, man, I know. Come on, you drove up in a nice car. I know you own your own business. You're a freaking doctor. Come on, I know how much money you make. You're doing fine. They're like, you just did this all day, right? And you're like, oh my gosh, you have no idea. Yes, I did that, but it's like I was on a unicycle with flames and, bullets coming at me and the parents are trying to hit me, right? And so that's why I'm here today. And what I would like is for these sessions to really be open. These are here as a way to support you, things you're going through. And no one's going to understand you like all of us are going to understand you. And so with that, just want to see if there's any questions or if this resonates with anybody, if anybody's been through anything similar too.
Yeah, I've got a question, Kyle. You talked about you started getting out and helping others. Talk about that a little bit and just that dynamic and how that was important for you as far as coming out of that dark place that you were in.
Yeah, that's a really interesting thing. If anybody is familiar with like the recovery community, I wasn't, but anybody who's been through Alcoholics Anonymous or narcotics or sex addiction or gambling or anything like this, whenever someone gets to like the 12th step, the 12th step, I learned this recently, is going out and helping others. And what's funny is that's what I see with burnout in dentistry is once I have people that have gone through my courses or, have been a mentee or something, and they get back to where they're thriving, all they want to do is help others. I mean, we had a guy that I showed you on that photo, his name's Narain, and he flew from New Jersey to come to our last course, brought friends, wanted to share his story just because of wanting to help our profession. And I think that's what's so interesting about dentistry is like, I rarely ever meet someone in another profession that loves their profession as much as dentistry, but that also gets beat up as much as they do. It's like an abusive relationship. It's like dentistry beats us up, but we just keep going back to it. And I think we love it so much that we just want the whole profession to benefit. We want our colleagues to do better. And so that's what I've seen is that's what happened with me. I got better, so then I wanted to help people. And now the people I'm helping are wanting to help other people. And it's this big ripple of positivity that I've seen happen, which is so rewarding to see.
How when you got on this positive journey, was it sort of like a singular event and everything clicked, or was it more of a process where you started gaining momentum and making progress?
Yeah, I was really so what made the change was multiple events over 1 year. And those were being threatened to be sued by a patient, attempting to be sued by a team member, and having a big complication with a clinical case. So all of those came together. Also, I had a 1-year-old kid, I was a first-time parent, like everything was coming together. I had my practice for 5 years, so it was like everything was a perfect storm for me. Once I made the decision, for me, it took me about 6 months of doing a lot of work and time, but I don't want it to take that long for anybody else. Like, I've done all the research, I've figured out what works with dentists. And so, most dentists, we can get back to like, thriving in like 30 to 60 days, which has been really rewarding.
Yeah. Wow, that's amazing.
Yeah, it was, because for me, I had to go do all the research, find that, try it, see if that worked. That didn't work. That did work. Okay, let me try this. Okay, that worked. Change this, change things in my practice. So it was a lot of self-reflection, testing. And then once I started teaching dentists about it, which was back in 2020, I started teaching actually in 2019 about it, and 2020 made it pretty official. And then it really started taking off.
I bet, and given COVID and everything everybody went through in 2020, that was a really good time to
Yes.
be sharing this recipe.
Yeah, well, it was nice because I had a bunch of time. Everyone
Yeah.
else had a bunch of time. Everyone finally realized that this was something we needed to work on. And so yeah, it was like a kick in the butt that I think our whole profession needed to make it happen. Since then, it's much more acceptable now than it was when I first started teaching about it, like in late 2018. Um, so it's nice to see that there's some more people talking about this. Like Fireside invited me to talk about this. I tell you, when I first started recommending to talk about this topic of mental health or mental resilience, everyone was like, nah, just tell us about implants. Just like do smile design again, like tell us about your lip research. And it took really 2020 to happen for people to say, we really need this. Now, my goal, going off of your question, John, is I hope that we don't have to wait till people are all the way at the bottom before they make a change. My goal is that they have the self-awareness, even just by being on these calls, to say, ooh, I'm kind of on the down spiral right now. My practice is getting harder. I'm thinking about my cases when I'm at home. I'm not really present with my family. My health is in a poor place. And then they make the change. I really hope that people don't have to hit the bottom like I did. But, people make decisions in a few ways, and one of them is when they're forced to make it. Like for me, I was quitting dentistry or I was going to figure this out. Those are my two choices. And I ended up figuring out, and I didn't have to quit, but I had to make some changes. I couldn't work 5 days a week. I went down to 4 days a week. I had to start setting expectations correctly with my team members, with my patients. I had to start, boundaries was a big thing for me that I was poor at. And I think a lot of us dentists are poor at. So I had to do some hard work, but gosh, it paid off for me.
Yeah.
Completely
Was
changed my life.
I have a kind of a question that builds on that. Was part of, I guess, maybe the struggle in making some of those decisions? Like, were you worried about the potential business impact of cutting back or setting boundaries? Like, was that a consideration for you of like, if I do
For
this, what
sure.
will
And what's
happen to the business?
crazy is the more boundaries I set, the more patients I dismissed, the more my practice grew. Now, how does that happen? Well, I saw someone speak that said 90% of your problems come from 10% of your patients. What if you dismiss that 10%? And I was like, hell yeah, let's do it. I went home, talked to my partner, Matt Najad, and was like, Matt, let's start dismissing patients. He's like, let's freaking go. So we dismissed 10% of our patient base. It was a lot. Within 6 months, we grew 20%. Now, how's that possible? Any ideas?
I mean, you just have the mental resilience to be able to handle more patients. I mean,
Well, there's different things. So that's one of them is like you guys all have that patient, right? You look on the thing and you go, Ian's coming in. Oh my gosh, he's the worst. Your team looks at it, they're like, Ian's coming in. Oh, he's so rude to us. He's always late, Dr. Stanley. The front office team's going, he never wants to pay. Da, da, da. Your whole day, think of your efficiency on your team when they're like that. Their
yeah,
efficiency goes down. Your efficiency goes down.
Mhm.
The other thing is the whole vibe of the practice changes. When you get rid of these people that erode your practice away, I mean, you guys know, the dentists that are on this call, when you have that patient that you love to treat, it is a joy doing dentistry. Dentistry can be amazing when you have that practice that sits there and they open wide. And for you guys, the parent's nice as well. They show up 10 minutes before. They don't complain about anything. They pay their bill. Like, dentistry is really fun when that happens. And so think if 90% of your patients were like that. They respect you, they say thank you, they show up on time. Dentistry can be amazing. So the whole vibe of the practice changes. And so when you have a new patient in there, they're like, "Oh my gosh, everyone's so happy here." Like, and so there's this bias that they see where everyone else is happy, so this must be happy, and then they're happy too. So that is how things change. The other thing is that you usually don't make good money off of the patients that are problem patients.
yeah,
Your team or you are on the phone with them. They're constantly asking questions about things. They're complaining about the bill. It's hard to collect money. They're late. I mean, I don't know what it is in pedo, but in the United States, what the ADA says, the average cost per hour per chair is $440. So if someone's 15 minutes late, you're losing $110, right? And, it can happen once in a while, right? We know. But if this is a constant thing, I would recommend dismissing these patients, setting a boundary, telling them you can't be late anymore, and then dismissing them. And what's funny is like when I started setting boundaries with people, they respected me more. I mean, you guys know who have kids on here, or even if you have dogs, like they want to have boundaries put into place. And when you do, they respect you more. Because think about it, like if my wife gets her hair done, she prepays just to get the appointment. And if she cancels, they charge her, right? If you go to a dog trainer, it's the same way. But we have a hard time setting these boundaries. So to bring this all together, we started setting a lot of boundaries. We started setting expectations. We dismissed patients, and everybody was happier.
yeah. I mean, Kyle, you hit something really well just then, just because, I mean, sometimes, especially us as pediatric dentists, we want our office staff, and everybody does. You want your office staff to be happy. But when they have to deal with these problem patients and deal with these problems on a cyclical basis, it just really wears your staff down and the capacity for them to handle even normal situations well. So when when you reduce that, obviously, it's just going to make the whole office just a better environment, more efficient, happier. And for me, like I've always said with my staff that I want them there for the next 20 years.
Mm-hmm.
Really try to think about that and think about ways that I can help them stay there for a long time. And that's crazy enough. We have had success with that. I actually lost a hygienist a couple of years ago, but she just came back about 6 months ago. So
Oh, nice.
we really have not had a ton of turnover, but I feel like one of the things that I've tried to do is set boundaries. Something as simple as I tell Katie, our front office manager, I'm like, if you get a call and it's somebody that does not want to pay their bill, and then you've explained everything you can possibly explain to them, and they just don't get it and they don't want to pay, and they're just being, mean about it, just say, that's fine. You don't have to pay, but we can't see you anymore as a patient. And so all of a sudden they flip and they're just like, well, they start changing a little bit. And she's like, no, it's okay. Here's a list of some other pediatric dentists you can see. We try not to give them anybody that,
You like?
yeah, I send them all to purpose.
Yeah, good idea.
No,
Yeah.
no, but I mean, it really is setting boundaries is huge with your office staff, because not only does it make their life easier, but they realize that you have their back and that you really do care about them. And
That's
and
what I was gonna say.
the dentist, when they can tell that the dentist really cares about them, the whole camaraderie of the office is just amazing. That I can honestly say that my staff loves being together during lunchtime. We have an hour and a half, and they usually go get something to eat real fast and come back and play games,
Mhm.
card games and stuff. So, it's huge setting those boundaries and just making your staff happy.
Yeah, you touched on a lot of things that I like to talk about, and one of them is appreciating your staff, but another one is protecting your staff, and I'm glad you said that. So we had people leave our practice. We had staff members that left because we prioritized the patients over our team. And it sounds just, and it sounds virtuous even, like, oh, the patient is always right. Like, let's take care of the patient. But no, you can't take good care of the patient unless you have a good team. So, for example, you have that patient that says rude things to your team members. Maybe they say inappropriate things to the girls in the room or something like this. You tell them they can't do that, and that's not going to fly here. And if it happens one more time, then they're going to have to leave. And it's crazy how people will change. I mean, we had a guy in our practice that always kind of said inappropriate things to our girls. And they told me, and this was after I had gone through my revelation. And I told him, and I said, listen, you can't say that stuff to our team members. It's really inappropriate. We like you as a patient. We would like to keep you here, but if it happens one more time, you can't be a patient here. And we'd be happy to, again, let you know where you can get treatment somewhere else. He never said anything again. And this was someone who every single time he came in, always said something inappropriate. And it was just a simple set the expectation for him, what he needed to do. And I can't tell you, the girls in our practice, we have an all-female staff, besides our videographer. And they were like, thank you so much, Dr. Stan. Like, we were so uncomfortable around him. Like, they would have crawled over glass for us at that point. And it's just because we stuck up for them. And, there's a lot of dentists right now that are like, oh, it's always a revolving door of team members in my practice, and it's so hard to find people that want to work. But a lot of times we don't look internally and think, how are we as a leader? How are we at protecting our team members? How are we at creating an environment where they want to work? And when we started to do that, the same thing, like you said, Jeff, the same thing happened was all of a sudden our team didn't turn over. We had the same people for so long now, simply because of that.
And it makes
The other thing I wanted to say real quick was you had talked about how you set a boundary with a patient and told them, like, we can send you somewhere else. And when you have this I call it a with or without you attitude, it's funny how that changes everything. I know when I started my practice, it was like, I need every patient. Every patient that walks through my door, they're mine, they're not leaving, and I need everyone else's patients too. Like, the answer is more patients. Yes. No. The answer is more of the right patients. And when you don't put pressure on someone, it's funny how attractive that is to people. Like when you're doing a treatment plan and you say, I would recommend doing this, let me know what you think and if you'd like to move forward. And if you're like, no, we really need to do this, this has to happen now, really pushes people away. I mean, in any business, but I think especially in dentistry. And when you start to be like, we have other patients that can fill the chair. Like, I'm here to help you. If you want to do this, go ahead. This is what I think you need, and this is what I think is best for you or your child. It's funny how that changes, but we have to change our mindset around that because so many dentists just think, I just need more, 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 more. I thought any patient that came through, had an exam with me, and I found something to do, I should take them on as a patient. And I've become much, much different in that idea, which is really like, do I want to take you on as a patient? Now, sometimes we get tricked. I know sometimes we get these patients that we think are going to be cool and then they're a pain in the ass. But in general, I feel like you can kind of tell. Like I have a binder rule at my practice. If you come in with a binder that has all of your previous records from all the 9 other dentists that you saw and no one else knew and everybody was an idiot, just give them their money back and tell them I can't help them.
Yeah. No, I mean that's so true. I mean, with us in pediatric dentistry, I feel like general dentists and beyond probably sell a lot of treatment plans. Like this, it's big to have a treatment planner in the office and all that kind of stuff. We probably don't as much in pediatric dentistry because what we do is like simple fillings, simple
Yeah.
crowns. But what we do have to sell sometimes is sedation. Uh,
Yeah.
so when, I personally have taken more time for those appointments. We block off a whole hour and we
Mhm.
usually do that time, but we do that just so that I have time to talk to them. But one of the things we always do, if I ever see that they're maybe not wanting to, if they have like a look in their eye, like, I'm not sure about this, I always tell them, and I love that Jerry Sampson, a guy down here in the South, told us, is he said the power of, just letting them know that you would recommend a second opinion. Like, and just letting them
Totally.
like, hey, it's totally fine that you're, questioning this. I would advise you just go get a second opinion. I would, and I always tell them to go get it from a pediatric dentist, one that is a
Yes.
specialist. But please, I want you to be comfortable with this. And, we have, honestly, we have so many patients that need this type of treatment. So I want you to feel comfortable with this and, go get a second opinion and see what they say. And when I say that, like, it's usually like, no, 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 we're good. We're good.
Yeah, I did the same thing. And I didn't learn that until pretty late in my career, actually. It was after I went through this difficult time, but gosh, that is powerful. And you're exactly right. They usually say like, "Oh no, like that's okay." Or they go home, they call you the next day or the next week. They didn't get a second opinion. Sometimes they say they did, but they
Yeah.
didn't, and they just schedule. Yeah.
Mm.
And it's
My,
that with or without you attitude.
my favorite, Dr. Brian Vidal up in Huntsville, Alabama, taught me one very important phrase. He goes, you know, when you see a parent kind of starting to pull away, you're like, you know what, we seem to have a little bit of a trust issue here. So I'm going to suggest, why don't you go get a second opinion? Here are 3 people, and he gives them people that he can't stand. And please talk to one of these guys, listen to them, see what their advice is. And if you feel more comfortable with them, I encourage you to stick with the people that you trust, because
Hmm.
I want you to trust what I'm doing for your child.
Yeah.
And
No,
I,
it's
right.
so good.
I feel like there's a trust issue here. So please, here are 3, go get a second opinion. It's not going to hurt.
I had a friend call me recently and they were asking their kid, I think their kid is like my age, like, or my son's age, like almost 8. And I think they had a bunch of decay and the pediatric dentist was recommending sedation. And they were just like, is this normal? Like, what should we do? And I asked them some questions and it turned out that it was it was a few fillings, but the child hadn't had a lot of dental experience up to this point. So you guys know how this is, right? They only bring the child in when they're 8 and have a bunch of fillings and a pulpotomy and a crown to do, right? And I recommended, yeah, do sedation because I see the patients when they're 30, they didn't get sedation and they've had dental trauma their whole life. And so I'm like, and these people could afford it. I said, yes, definitely do that. But it's funny how they didn't trust the pediatric dentist they went to, but they trusted me as a friend that they, knew had no
Mhm.
financial incentive, right?
Yeah.
And I think when you tell them they should get a second opinion, it's almost like you're removing the financial incentive from you.
Yeah,
You're
exactly.
saying, get a second opinion. If you find someone else, cool. If you want to do it with me, great.
Mhm.
Because that's the hard part with dentistry is that we have a trust epidemic. It's just like, I'm really into cars. And I'm one of these guys that's really into cars, but I can't build my own engine. I could change oil, I can change a tire, but like if you tell me to point out the timing belt, I don't know where it is. So I drive 45 minutes to go to a mechanic that my family's been going to for 30 years because I know if he tells me something, I need it. And if I don't need something, he's going to tell me. And I just have complete trust. He could even come to me and say, "You see, the timing belt is needs a new one." I'd be like, "I don't know what you're talking about," right? And so it's that trust thing. Once we can find someone that we can trust, and I know it's the same that you guys see in pedo, they don't want to leave. They're 25, they just graduated college. They're like, "Can I still keep coming here? I want to play with the little toys in the front." And it's because they trust you.
Yeah, exactly right. Kyle, let me ask you one thing real fast. But you mentioned friends coming to you. And you would feel this, I don't know if you took loans out like I did, but went to
Yep,
USC, tons of loans.
that was full loans.
One of the comments I usually get, because I see a lot of my friends' kids, and so they'll, if we ever plan a vacation or do something like that, they'll make the comment in church or something, hey, I'm glad I could contribute towards that vacation of yours. Or
Yeah.
just they're not trying to be mean by any means, but they just, little jab. Uh,
Hmm.
you know, part of me wants to say, do you know what it took to get here? Do you know that I'm a first generation dentist that, I took out,
Mhm.
$600,000 in loans. I mean, to do this education. And I'm like, if you want to take that on for me, great. I mean, what do you, have you ever encountered that? And what do you say to your friends?
Oh, yes. I actually made an entire Instagram post on that. And I'm
Okay.
going to see if I can pull it up here because some of it is tongue in cheek, what you should say, and some of it is actually what you should say. So hold on, let me see if I can pull this up.
Tongue in cheek is great with me.
Let me find this.
Remember, we're pediatric dentists, so we tend to be more people pleasers.
Yeah.
Right. Well, I mean, all dentists are people pleasers.
Yes.
Yeah.
So that, maybe not all, but a significant amount of us are pleasers. Here we go. Okay, let me show you this. Can you guys see this?
Yeah.
So I usually go with the red one.
Yeah, exactly.
The
Yeah.
red one is usually my answer. I like to go two extremes with this. One is kind of like a joke way. So like usually they say, "Oh, I just paid for your next car payment or something like that." And I say, "Oh no, I paid for that in cash." So I go like the total opposite, right? Or I do the red one, which is I'm still actually paying off my own school because in this relation, in this example, they're talking about like, "Oh, I just put your kids through college." That's what people love saying. That's like the classic one that we hear at least.
Yeah.
And so I'm very upfront with people now. This is one of the things that I got good at after going through my dark time. And sometimes I'll just say, "Wow, that's kind of rude." And then just stop.
That's great.
Like that one.
Because, are we not allowed to make money? I mean, we're not running charities, right? All of us do charitable work on, children and, Jeff, you and I did a lot in dental school. Um, but this is my business. Aren't businesses allowed to make money? Like, do you complain to the owner of the grocery store? Do you complain to the gas station? Of course, no one wants to pay for anything. It'd be nice if everything was free, right? But I've become a lot better at setting boundaries with people right away. It's just like when people say, like I'll meet someone somewhere and they'll say, "What do you do?" And I say, "Oh, I'm a dentist." And they'll say, "Oh gosh, I just really hate dentists." I usually say like, "Remember, I just told you I was a dentist." That's really rude of you to say. And I've had this like on planes before where we're sitting next to each other for like the next 6 hours. And I say, that's really rude of you to say that. And then we sit in silence for the next 6 hours. But I just got so sick of it. It was like the first 5 years didn't bother me. And then the sixth year kind of got to me. And then the seventh year. And, after 14 years, I'm just like, Jesus. And so, I don't know, to answer your question in a short way, I like to kind of set a boundary at the beginning.
Yeah.
Or you could say, yeah, you did pay for it because I run a business. I took really good care of your kid too. So I hope that'd be worth it for you. You could have went somewhere else and they maybe could have done a worse job, but I did a really good job on your kid. And hopefully that tooth will stay there the rest of their life.
Yeah.
And I know that's hard when you're dealing with people that are friends or go to your church or in your community. But again, I think when you set boundaries with people, they respect you more.
Yeah. I agree.
Well, I've never said that to my dentist, but I say it routinely to the orthopedic surgeons that see our kids when they get hurt. So I have to confess.
Yeah, I had this realization. So I'm a hockey fan, and we have tickets to see the Ducks all the time. They always lose, but it's still fun. And the last game we were at, I grew up as a hockey player. I played AAA. I got drafted to University of Connecticut. I was like a high-level hockey player. And so I grew up in it. When the refs come on the ice, if anyone's been to a hockey game, you boo the refs, right? Immediately. And my wife, who didn't grow up with hockey, is like, why do you boo the refs? And I was like, oh, just because like everyone hates the refs. And she was like, they're just doing their job. And I was like, oh my gosh, the refs are the dentists of hockey. And so I don't boo the refs anymore. And it's like, that's what's so hard about dentistry too, is there's this trust deficit. And also there's this general poor view of what we do. And it's like people hate us until they really need us. And then we're really important, right? Now, you guys are in the right profession because I remember someone at dental school said be an endodontist or a pedodontist because people will do anything for their kids or when they're in extreme pain. No, I don't know if that's necessarily true, but that's why it's so challenging to be a dentist. And I think nobody talks about it, but we all go through the same thing. And that's why groups like this are so important because there's probably people on this call that came into this call thinking they were the only one that gets annoyed by their friends saying this or, they're someone they see at church saying this. And so I think having these discussions and talking out loud about it can normalize this. And I think it brings our whole profession up.
Yep.
What other questions do you guys have?
I was just thinking about being a pediatric dentist and just kind of the extra level of stress that's involved there, just because you're not only having to please the child and make sure they have a great experience, but you also have a second patient in the parent.
Yes.
And just the added stress that can bring, I think is pretty interesting to think through. What are some of your thoughts around that?
Well, I think what I said earlier is something that nobody talks about that I see as a general dentist who tends to see older patients is pediatric dentists have such a responsibility to give children a good first dental experience that stays with them the rest of their life. I'm a great example of that. I grew up in a dental office. My dad's a dentist. I was never afraid of the dentist. I didn't even know people were afraid of the dentist until I was 17. I was in high school. My friend came to me at lunch and was like, I'm so nervous. I'm like freaking out. And I'm like, what? He's like, I have to go to the dentist today. And I was like, okay, what does that have to do with being afraid? And he's like, because the dentist sucks. Like it hurts. And I was like, wait, you're afraid to go to the dentist? Like, I didn't even know. And because of that, I have pretty good oral health, right? But then you have these people that, and most of the time I would blame the parents, is they don't prioritize it. Then they come only when they have a problem. And so their first experience is getting a palatal injection, for example, and then they're afraid the rest of their life. So their parents may pay for dentistry until they're 18. Then they go to college. They don't go to the dentist. They maybe get their own job. They maybe only have their own family. And then they don't go until they're 35 and they need a full mouth rehab. And then they have this bad experience again because it's expensive, it's time consuming, it's painful maybe. And so I think what no one talks about is the pressure that pediatric dentists have to set these children up to be non-dentist fearing for the rest of their lives. And I'm interested to know if the pediatric dentist on the call, if you feel that.
Yeah, I mean, for sure. I mean, we encounter it pretty much every day. I mean, one of the things I've always told the parents, and it usually involves when we're talking about a good experience, it's kind of funny because sometimes we are trying to convince a parent to say, hey, no, Johnny can do really well. I know he's only 4, but I promise you, I've seen him do his cleanings. He's been here since he was 2. I promise you, I can get it done just here in the clinic. And sometimes convince them not to do a sedation.
Mm,
Sometimes we have to convince them to do a sedation too. And it's like, no, I mean, and I'll tell the parent, you know, studies have shown that if a child has a bad experience from the time that they're like, 3 years old till the time they're like 14 years old, they tend to not want to go to the dentist later on. They're fearful of it. They don't even want to brush their teeth at the house because they have this internal anxiety about oral things.
yeah.
And their whole oral health can just be set off in the wrong direction if they have these bad experiences. So I'll tell the parent that all the time, and sometimes they do understand that. But yeah, I mean, it's a big pressure, facing that every day, trying to let kids have a good experience, trying to make sure that your staff is upbeat. We have a common expression that's really stupid, but we always say, let's be surprisingly upbeat. I think it's in some
I like that.
but I mean, it is pressure, and it's draining to do that too, though, because
Yes.
I kind of laugh sometimes because I have my pediatric dentist face, and all of a sudden I go right behind a corner, and I just like, and
Yeah.
it just like shuts off, and it's just a lot of, you can just feel it. You just feel your body relax once you're not doing that. So it's a lot of stress that you carry every day as a pediatric dentist to try to please moms and dads and the patient.
Yeah. I like that you said about the draining feeling. I heard this expression somewhere that a lot of dentists are forced extroverts.
Mhm.
A lot of us kind of did well in school and we're good at reading books and we're good at studying. And then all of a sudden, you're customer service every day, right?
Yeah.
And even me, I'm an extrovert and I still get drained from doing it for 8 or 10 hours. Like I'm a good extrovert for a few hours. As I've gotten older, I've gotten even more of an introvert. And I think COVID made me more of an introvert too. But even, when I was doing full-time clinical, like it was exhausting because you never really have a time to enjoy what you did, right? Let's say you guys just finished, you just did like a 2 surface filling on a difficult patient. You finished, you check the bite, it's looking good, the margins are great. You never really have a chance to sit there and just go like, yeah, that was great, right? Because you go to the next room and there's another problem. And there's another problem. There's another problem. And it's hard to deal with that day in and day out. Just constantly dealing with problems, getting through something very challenging, and then having to go in and be like, "Hi, I'm Dr. Stanley. Good to meet you. Thanks so much for coming to our practice. Let me tell you about this." It's like a mask we have to wear, which I think is challenging internally. I know for me, when I was at my lowest point, I would sit in my car before I went in, I would cry, and then I would kind of wipe my tears, put on a happy face and walk in and go, "Good morning, everybody. Hey, how you doing?" And you can't go in and just be a grump all day, right? And that was hard for me because I felt like I wasn't being true to myself. What I realized was I needed to learn how to have more self-mastery over my own emotions because it's like having the emotions is normal and you should be able to have the emotions, but acting on the emotion is a choice. This is what I had learned that pretty much blew my mind from one of my mentors is that there's a space between stimulus and the response. And this was something that a guy named Viktor Frankl thought of. And in between that stimulus and the response is that space. And in that space is your place where you can grow. So I used to be very reactive to where a patient said something and I immediately reacted. And now, even with my kids, I've gotten so much better at having the awareness that I'm having this feeling, thinking, how do I want to react to this that best serves this situation in the long term? Changing that and then acting on that in an appropriate way. Now, I'm still a human and sometimes I snap, but that space has gotten bigger and bigger and bigger for me. And I can really live in the space. Just the other day, I was just talking about this on one of our podcasts. We were going to get our Christmas tree. And it was the end of the day. Our kids were really excited, but gosh, they were being so annoying in the car, like so annoying. And I don't know about you guys, but the older I get, the more loud noises bother me. And this is weird for me because I used to be in like a metal band, so I would like turn everything up to 11. I mean, you remember my hair, Jeff.
Yeah.
But like we were in the car, my kids are screaming, and I'm just like, I first noticed that I was spiraling a little bit. Then I breathed a few times in the car. And then I had to decide how was I going to act. This is usually a special time, that we only do this once a year. I wanted to turn the car around. I was at the point where I'm like, let's just turn around, let's try again another day. And I was able to change and act what helped the situation better. But it took me like 6 years to get to that point. And that's kind of a good way to end today, too, is a lot of these mental health skills, relational skills, boundaries, expectations, communication, a lot of them are skills that we don't think about as dentists. We think skills are only hand skills. So like you remember the first time you did a pulpotomy. It was horrible. You prepped too big, you prepped too small, you took too much away, you went through this, maybe went through the furca, I don't know. I did that definitely. Something bad happened, right? And then you got better and better and better. Now it's no big deal. And that's exactly how communication is. That's exactly how boundaries are. That's exactly how, living between the space of stimulus and the response. And that's one of my big pushes with what I like to do is teach and convince dentists that all of this is a skill, just like how prepping a crown is a skill. You have to put time and money and effort into it, but you get better at it. And when you put money and time and effort into something, you get better at it. So everybody that's on this call, you could be doing something else. You could be taking a clinical CE. You could be, hanging with your family. You could do whatever. But you've chosen to be on this call with a weird skinny guy from California talking about mental health. And what happens is you'll get better. Like maybe this week, you're having that parent that you have to put a boundary in, and maybe you'll do it. Even if you just have the awareness and you don't do it, that's still a big growth.
Yeah.
The awareness is the biggest thing for me. Once you have the awareness, my jujitsu professor says a problem understood is a problem half solved. And I think that's so true. Just having the awareness that you're feeling a certain way, that a patient is acting a certain way, that your team member might be offended by something, that your team member may not love the situation you're putting them in is a great first step. And then you can start thinking of where you want to go from that.
Good.
Good stuff, Kyle.
Yeah, any final questions? No. Well, I hope that today was helpful. I think we had some good topics. And I'll tell you, even for me, continuing to talk about these things selfishly helps me. Even when I'm teaching it, I'm relearning things. I'm getting better at it. And again, it's just the awareness of having it in my day. So I think doing these monthly calls is something that you will grow. You'll start to notice things. You'll start to be aware of things. And then you start making changes and things will change for you. Because dentistry is challenging, especially working on children is challenging. And I think you have this group that can support you in that.
Yeah, I look forward to, as we grow as a company, I look forward to seeing so many more pediatric dentists taking advantage of this.
Yeah. Yeah. I think we can create a really cool community that can really help the specialty of pedo too.
Yeah.
Thank you, Kyle.
Thank you, Kyle.
All right, guys.
All right, thank
Have
you
a
so
good holiday. Reach out to me if you guys need anything, if you have any questions. Oh, for anybody on the call, I'm doing a free masterclass tomorrow. Just I wonder if I could put that in the chat. It's not for pediatric dentists, for everybody, but if anybody's interested.
Yeah, we'll share that. We'll post that in our community for anyone
Okay,
that
cool.
couldn't join. And I think this is a great conversation. I know people will be excited to hear the recording, listen to it back as kind of a podcast. So I think so many more people will get value out of this conversation. I appreciated listening. I feel convicted. I need to schedule my daughter's 6-month appointment. I've been dragging my feet on it, but I don't want her to be one of those only
Yes,
going when there's a problem. So I'm gonna
that's
call
right.
tomorrow and schedule.
Yeah, yeah, good. That's good parenting right there, Allison.
All right,
Awesome.
thank you so much, Kyle.
All right, talk to you guys later.
Bye-bye.
Bye-bye.
Bye.
Bye-bye.
Good night.